I'd ask for roll call, Marcia Lewis,
Marcia Lewis here.
Elizabeth Kirkpatrick. Thank you. You're mute.
All right, Elizabeth Kirkpatrick here.
Paul Schubert here. Meeting has come to order. On the agenda, it should be fairly quick, but I think there'll probably be some questions about what this entails. This is a tobacco inspector, and we're appointing an agent to the Board of Public Health as required for tobacco inspection. So I will ask Cam to take over and introduce Kathleen Mahoney, who is here with, I guess, quite a bit of experience as well. Welcome.
Yeah, thank you. Kathleen is a very experienced tobacco inspector. She's been inspecting many South Shore towns for years as part of a tobacco collaborative under a grant from the state. And eventually we'd like to join that collaborative, but it's not offered for a couple of years. So in the interim, we've asked her to do inspections in the town of Cohasset and Scituate as part of our public health excellence grant. So Kathleen, it'd be great if you could introduce yourself and just let the board know just basically what you'll be doing for us.
Hi, yep, I'm Kathleen Mahoney. I'm the South Shore Tobacco Inspector / Compliance Officer. I've been doing this now for 5 years. I have 8 towns currently, and I'm going to be helping out you guys as well. So basically what is required is that you guys do a tobacco inspection for each and every, I think you have 8 is in the list of retailers that sell tobacco. So I go in, what I'd like to do is go in, do the first inspection, and I educate them on everything to make sure everything's all set, make sure they have the required signs by the state, and just go over the regulations to make sure that we're all on the same page. If I find a violation, generally I usually do a warning because they're not used to me. And then I'll go back and double check to make sure that they're in compliance. After that, I do compliance checks, which I'll send in an individual that's under the age of 21 to go in to see if they can buy a product. So that would be the next stage. But I always like to go in and educate, and I tell them I'm going to be out. I will be doing compliance checks. It's just not me out here. The FDA's out here doing compliance checks. Department of Revenue's out here doing checks. So make sure you're on your game and ID everybody. So I just like to go in, as I said, introduce myself, educate them, go over the mass law, go out and go over your regulations so we're all on the same page. Do you guys have questions?
Yeah. So the regulation would involve basically, majority is going to be underage sales, but I guess, does there anything to do with like the storage and things like that, or is it more sales?
So it's what it is. Like I was looking over your regulations, so I go in to make sure they're not selling any blunt wraps. Make sure the cigar pricing is in line with your regulations, because each town can have different regulations. So that would be like my part as far as for your town. And then after that, I will go in and just make sure that so there's 2 inspections, a Board of Health inspection, that's my educational one. And then the next inspection would be the compliance checks. So those are the 2 major ones.
Any other questions from the board? No? Right. So
Actually, I'll ask a question. How do you find those underage people who come in and try to purchase?
That's a really good question. So that is, I think, the most difficult part of my job is finding these kids. I usually go to the school resource officers, and lots of them will talk to their kids and they'll step up and say, yeah, I want to do this. I also have some friends that have kids around the age that I need.
Right.
So I beg and borrow. But yeah, either school resource officers, the friends, and then there's also a thing called the 84 Club. Are you guys familiar with that? So it's different groups for different schools throughout Massachusetts. And what they do is they get together and they fight big tobacco companies, and they show up at our hearings and talk to the board members and say what they're seeing in school. They're always really good to use. They go to the State House on what we call Kick Butts Day, and they talk to all the lawmakers. And I've been there 3 times, and I am completely blown away what these kids do. I don't think I could do it at that age. But they are amazing going in. And they've had a lot of, before the flavor ban started in Mass, I had different towns going to ban it. And I'd have them come in, and the board members are just like, wow, let's do this. These guys are great. So that's my different ways. And then sometimes I go to different churches to see if some kids want to.
Oh, that's a good idea too. Thank you. I was just curious.
Yep.
And Kathleen too, isn't Nicole from Safe Harbor also gonna try to help you too with some kids?
Yes, she is. So yeah, I went to Kick Butt's Day with her last year. So yeah, she's hopefully going to help me too. I always need kids because unfortunately they age out. They're busy with sports. I always work around their schedules. So some people, and this is kind of works well for me, they never expect me on weekends or holidays or nights. I work all of them. And I do tell my retailers, I'm like, I work weekends, I work nights, I work holidays. So you never know when I'm going to be in here. So make sure you're IDing all the time. So whatever works for the kids.
So what happens if an underage person is sold a pack of cigarettes? What's the next step?
So then what we'll do is we send out a letter that such and such date, whatever product was sold to underage youth. And usually we have them appear in front of the board, or if they might not want to, and then the board decides what the next step is. With the new Massachusetts law, to a sale to a person under 21, the first violation is 1,000, second is 2,000, and the third is 5,000. That's law. So that way you guys, you don't have to worry about anything. It's the law. I'm following the law. Also with the law for a sale to a person under 21, it's mandatory suspension of their permit up to 30 days. So it could be 1 up to 30. Each towns do something different. Right now, I'm trying to get my towns to put in their regulations that if there's a violation, whether it be a sale to a person under 21 or a blunt wrap violation, that the first violation is, say, 3 days, second violation, 7 days, third violation, say 15. So it's in the regulations and they don't have to worry about it. It's right there. It's a state law that's suspension. You sold to a person under 21. We're going to do 3 days suspension. That's it.
So does that person just kind of walk out of the store with a pack of cigarettes and not say anything?
Yes.
Yeah. Okay.
And they have training. So for example, they're not allowed to lie. If they ask my youth their age, they have to tell the age. Sometimes they ask the date of birth, whatever it is, they cannot lie. So they just go in, they ask for the product, and I usually know what my retailers sell. So I will say, okay, you go into this store, ask for a clear 3% disposable vape, and they'll go in and ask that. Then there's other stores, like say liquor stores. A lot of them will just sell cigarettes and cigars. So I'll have them go in and ask for Marlboro Red. So they'll go in, they'll ask for it, they'll pay for it, and walk out.
Are you present? Are you like waiting in the parking lot for these
Yes.
teens?
Just in case anything happens, I like to witness it. No, I didn't sell. And I'm like, I was there in the parking lot. I saw my youth go in, and all they carry is their phone in case there's a line or something happens. They can text me right away. And the money that I give them, it's not like they have anything else on them. So,
Thank you.
and unfortunately, a lot of them, well, in my 5 or 8 towns that I have, they do know my car now. They know my name, they know everything. So I try to use, like, some days I'll use my son's car. I'm like, hey, can I use your car today? He's like, oh, Mom, are you going out again today? I'm like, then I got to fill it up with gas for him, but that's okay.
Yeah.
I should pay.
Exactly.
Well, very interesting. Any other questions? This has been quite informative. I didn't realize the fees and the fines were so high. That's pretty,
Yeah.
pretty steep.
It is. But know what's kind of, I think, disturbing is when we give these retailers the fines, they're like, we don't care about that. We'll pay them. We just don't want the suspension. Even like $5,000, they don't even blink. They don't want the suspension because that's how much money they're making on tobacco products.
So your role is just restricted to tobacco, doesn't include alcohol. And if
Right.
not, who does is it a whole separate
The
exercise?
police,
Yeah.
the police
The police.
department does alcohol.
Okay.
Yeah, yeah, that's police and the Board of Selectmen, the Select Board.
Yeah.
Okay.
So-
any
Yeah, it's
other,
interesting.
Any other
I
questions?
do have a quick. So Kathleen, do you recommend that we update our tobacco regulations to match the new state law and put in, the things about the suspensions?
I would, yeah. I was looking at yours. They were done in 2016, I believe.
Yeah, I was part of that.
Yep. So yeah, there's some things that we can definitely update and look at it and see. I could definitely, Pam, come in and have a conversation with you and we can go over a few things. Absolutely. And I have no problem going to the meetings and talking to the board.
Okay. All right, well, that will be for another night. That sounds good. Thank you.
Sounds good.
Excellent. So if there are no more questions, then I would ask for a motion to appoint Tobacco Inspector Kathleen Mahoney as an agent to the Board of Health as Tobacco Inspector. Is there a motion?
Sure, I'll make a motion to appoint Kathleen Mahoney as an agent to the Cohasset Board of Health to conduct tobacco inspections.
Is there a second?
I second.
And we'll go to a roll call vote. All those in favor, Marcia,
Marcia Lewis, aye.
Elizabeth,
Elizabeth Kirkpatrick, aye.
and Paul Schubert, aye. The motion passes unanimously. Welcome aboard. Thank you for
Great.
stepping
Thank
up.
you. I look forward to working with all of you.
Thanks.
Excellent. So
All right. Thank you.
So that's the only have is topics not reasonably anticipated by the chair. Just a couple things. I guess Mary Goodwin is retiring, which I just saw. She'd been here, gosh, a long time. She's lived in town, I think even longer, and she's done quite a bit of work over, particularly the last 3 years with COVID. So when she's on next, we can probably give her a big virtual hug and let her know what her job was greatly appreciated. The other quick thing I have is just the numbers of the hospital with flu, COVID, and RSV. They're all, and we've got about 600 in the census. All of the COVID and the flu and the RSV are all in single digits. So for the first week, there's more flu than COVID. So there's, I think, 7 or 8 flu this morning, 5 COVID, and a handful of RSV. So this is the first week where it's been single digits for COVID since beginning of the pandemic. I think there were a few days in the first summer that it was down low. So I think we're, I don't want to jinx it, but I think we're out of it at this point. So as long as we keep up to date with the, general routine of vaccination and keeping careful. That's
So
all
what
I
do you
have.
think about the CDC new recommendations? I don't think they've been formalized, but
They haven't, and I think we're compared to 2 years ago, where we did not have adequate vaccination profiles and Paxlovid and some of the other antivirals. It was a different situation in a lot of the hospitals. As of now, with very good preventative maintenance with Paxlovid and some of the other oral antivirals, the spread can be contained pretty quickly. And we haven't seen large outbreaks where, a large economic sector gets struck down like we saw at the beginning. And we've got a pretty good vaccination profile in most of the country. So, if somebody is febrile and sick, there probably should still be, quarantining. If there are no symptoms, you'll see a lot of people that test positive without symptoms. And it's always a question of what the viral load is. Can they, to a significant extent, spread it? And it looks like probably not, from what we've seen, at least in the hospital and in the community, that you'll see, household contacts about 50-50. So household contact with a fully vaccinated family member, it's about a flip of a coin if that person is vaccinated will come down with it. So they may do like a 5-day quarantine if you're symptomatic at this point. We'll
But
see.
don't you think a recommendation not to isolate will lead to a decrement in testing?
It very well may, yeah. And
That's what
I
I'm
think,
worried about.
yeah, there's a lot of, there's a lot of places now. If you're going to work, you don't test because you don't want to know,
Right.
because if you test, you got to tell your supervisor, your boss, the owner. And a lot of people aren't doing that now. So it's, it's still smoldering in the community, which is unfortunate, but not to the, the hospitalization or death profile that we saw a few years ago. It's even worse in the South. I mean, you go to, hospitals in Florida, it's double the percentage of admissions. So that's all I have. Any other questions or comments or things? All right, then I guess I'd ask for a motion to adjourn. Is there a motion?
I make a motion to adjourn the meeting.
Is there a second?
I'll second that.
And roll call vote, Elizabeth,
Elizabeth Kirkpatrick, aye.
Marcia,
Marcia Lewis, aye.
Paul Schubert, aye. And the motion passes unanimously, and we're closed for the night. And we'll see you next month.
Okay, thanks a
Take care.
lot.
Everybody,
Bye.
bye.